Hello, I'm Elliot Antman, President-elect of the American Heart Association. We're here in Amsterdam at the European Society of Cardiology. Hotline 1 led off the long list of trials that are being presented here at the ESC. This dealt with thrombosis, and two trials that attracted my attention involved some of the new drugs that we've been hearing about, the novel oral anticoagulants, the novel blood thinners, things that can be potential replacements for warfarin, sometimes referred to as Coumadin. So one situation where we might give an anticoagulant would be if a person has a blood clot in the veins in their legs. Venous thromboembolism is what we're trying to prevent. And there was a new drug, edoxaban, that was studied compared to warfarin, and it was found to be similarly effective as warfarin, but a lot safer, much less bleeding with this new drug. And this is a repeated theme that we've been hearing about the novel oral anticoagulants. Now, one of the other novel oral anticoagulants, dabigatran, was studied to see whether or not it could be used to prevent clot formation in patients who have mechanical heart valves. And here the results were not so good. We found in this study called REALIGN that the drug dabigatran actually was not helpful and actually was potentially harmful. Not only were there more clots, but there were more bleeding events compared to the standard of care, which is warfarin, for prevention of clot formation when a patient has a mechanical heart valve. So good news in venous thromboembolism. We've already heard good news in other trials about the new drugs for prevention of stroke and atrial fibrillation, but not such good news for prevention of clot formation in patients who have mechanical heart valves. Always very interesting to hear about these new therapeutic options at an important meeting like this, the European Society of Cardiology.